Good afternoon and welcome to today's broadcast. Today's presentation is titled Understanding Genetic Diagnosis and Novel Therapeutic Strategies for Duchenne Muscular Dystrophy. I'll be today's moderator. My name is Derek Stevens. I'm the Director of Marketing and New Product Development here at Emory Genetics Laboratory. I'd like to introduce our panelists for today. First, we have Ann Lucas, MSCGC, who is the co-director of the Duchenne Connect Registry for Parent Project Muscular Dystrophy, also known as PPMD, as well as co-PI of the Duchenne Connect Patient-Powered Research Network. Prior to her time at PPMD, she served as in a variety of genetic counseling roles in pediatric, prenatal, and research settings. Our second panelist, Ann Martin, MSCGC, is a genetic counselor with Parent Project Muscular Dystrophy and co-director for Duchenne Connect, an international registry for Duchenne and Becker muscular dystrophy intended for patients. Before joining PPMD in 2011, Ann worked as a genetic counselor for 15 years at Carolinas Medical Center in Charlotte, North Carolina. She has worked in a variety of settings, but always had a special interest in neuromuscular disorders. Just one housekeeping item before I turn the presentation over to Ann. If you have questions, please reserve them to the end of the presentation when both panelists will be available to address any that you may have. And at this time, I'll go ahead and turn the presentation over to Ann Lucas.
Thank you very much, and thanks for joining the webinar. And I think everybody can see my slides now. I'm Ann Lucas, as Derek has introduced us already, and Ann Martin and I will both be presenting today, and we have Lauren Mackey on here as well, just because Lauren is also one of our genetic counselors with Duchenne Connect and Parent Project Muscular Dystrophy, but unfortunately Lauren couldn't make it today due to a family emergency. And I wanted to show her picture and introduce her just because she can be a valuable resource to you and your families. She heads up our Decode Duchenne program, which Ann Martin will talk about later in the presentation. But she is a valuable resource for you and your family, so please make sure that if you have any families with Duchenne that you reach out to her. So just a little bit about us. Thank you, Derek, for the introduction. And we really appreciate Emory hosting this and inviting us to present. And we're also very grateful for Emory's collaboration over the years. They really have helped us along as a nonprofit organization. They were with us in the very beginning with our patient registry and have been a great collaborator throughout the years. So we really appreciate you working with us. So we both work for Parent Project Muscular Dystrophy, as Derek pointed out, and we call it PPMD for short. And PPMD's mission is to end Duchenne. And the four pillars that PPMD uses is an acronym called RACE. So research, advocacy, care, and education. And we try to work in those four areas to do all that we can do to make the lives of our boys and their families as good as we can make it, to find ways to improve the research, make it faster, to educate our families, and to advocate in Capitol Hill for more funding for research, for better laws around people with disabilities and those kinds of things. So today what we really want to do is to describe to you in the Duchenne community how the current trends in research and care have made the genetic diagnosis for Duchenne so important. And this is where you can help our families the best, is getting that genetic diagnosis and making sure that they understand it, have access to information around it. We want to also point out to you how families, when they participate in Duchenne Connect, which is our patient registry, we'll tell you more about that in a bit, it will actually have some benefits to them as individuals, but also to the overall Duchenne community, and we'll describe how we use that data to do those things. And then the other thing that we really want to make sure you understand is the Decode Duchenne program that we have, and how you guys can have access to that. So why is this so important right now, and why should you be worried about it? with Duchenne, the time to diagnose is still roughly 2.5 years from the time the parent or caregiver noticed first signs of any issues. And that's still too long. The average age of diagnosis is still around 5 years. It's getting younger, but we still want to improve that. And one of the things that PPMD has done in the past is to help create a website called childmuscleweakness.org. If you don't know about that, I recommend that you check out the resources at that site. Just has some really good basic information about muscle weakness, when to draw labs, how to talk to families, and it's just a really good overall website. It's also good for families. There's some great information here for them. But if there is delay in muscle weakness, we do recommend drawing a CK and then going from there. Historically, to make the diagnosis of Duchenne in the early days, it was really truly made by the presenting symptoms and then drawing the CK and then the muscle biopsy. The dystrophy identified as a causative gene in 1986, and mutations within that gene cause Duchenne and Becker muscular dystrophy, Duchenne being the more severe phenotype. Boys usually start showing symptoms in toddlerhood or earlier. They typically are wheelchair bound by the age of 12 or so, and average age of death is in the mid-20s right now. So now, in the year of 2016, diagnosis is typically made by DNA testing after a patient presents with delays in a positive CK. There are cases where we'd have to do a muscle biopsy, but it is more of a rare event now. And just to show you, I've briefly described how we diagnose, but we're also thinking how are we going to treat Duchenne? And this is a complicated graphic, but if you'll notice, there are different pathways that we're trying to hit when we're thinking about treating Duchenne. We know it's caused by that mutations in the dystrophin gene, but that event causes a cascade event in the muscle. And so all of these different areas, muscle growth and protection, mitochondria, blood flow, cardiac therapies, dystrophin replacement or restoration, inflammation and fibrosis, and calcium regulation, those are all ways to kind of hit at those different areas in the pathway. And probably the most important area for genetic counselors is the dystrophin restoration replacement types of area. So exon skipping and stop codon read-through is the two main areas that you will most likely encounter patients coming to you with questions. And really, this is the critical area where patients really do need their DNA testing done. So the two main areas I'll just briefly talk about are the stop codon read-through therapy for Duchenne, which PTC Therapeutics called adaluron or translarnin. And this will actually benefit roughly about 10 to 15% of boys with Duchenne. And currently, they are in talks with the FDA for approval in the U.S. They did receive a failure to file notice this year, and they're ongoing discussions with the FDA at this point to see how they can move forward to get this to the boys that need it. The other drug that's been a lot in the headlines in the Duchenne community is eteplirsen for exon skipping of exon 51. And this is estimated to be a potential benefit for about 13% of the boys with Duchenne. There's certainly other exon skipping drugs in the pipeline, and it's something that there are several different companies working on that. Sarepta Therapeutics is one of the bigger companies right now. They have had their advisory committee before the FDA, and the FDA is we're still waiting to hear their decision about whether they're going to receive approval for that drug. So we want to make sure that you realize there's lots of different things going on as far as the therapies in the Duchenne community. It's complex, but some of these therapies that are specific to a very specific mutation, it's critical that those families know their mutation and understand what that means for them. This graph, you don't have to read all the little words, but just wanted to show you that, and this is actually slightly older, this shows you all the different clinical trials in the Duchenne space, and the different phases they're in. So you can see there's quite a few. For a rare pediatric disease, we are very excited to see this many clinical trials. When we have an annual meeting where our families come together, and 2 years ago, I think there was roughly 20 companies in the space that were interested in Duchenne. And this past year, there were over 40 companies in this space that are interested in Duchenne. So for a rare pediatric disease, this is just an incredible time for our families and for our patients, and we're very excited, but there's still a lot of work to be done. So we know that in our Duchenne community, we need more of our boys tested. We need to improve the understanding of those test results, both in their primary providers and the families themselves. PPMD also noticed over the years that we needed to improve the connectivity between all the stakeholders, so patients, providers, advocacy, industry, researchers, and we needed a way to leverage data that was out there so that we could impact research and advocacy and clinical care in powerful ways. So what is PPMD doing, and what have they done so far to address those needs? Taking you back to the earlier slide that I showed you where we have the 4 pillars of research, care, advocacy, and education, we asked ourselves what is it that we need to do as a community to better do all of these different things. And just to let you know kind of how PPMD works, this is the drug development pipeline, and we have several different strategies to help along that way. That are things like we have research awards that we give individual researchers. We have corporate research and clinical trial support. We work with the FDA and regulatory guidance. We have a newborn screening program that we're trying to start and have different committees that are in the works about that. We worked on Duchenne FDA draft guidance, and we're the first patient advocacy group to actually draft a guidance document for the FDA, and the FDA did take that and then drafted their own accordingly, and now that is published and companies can use that. So when PPMD looks at the entire landscape, they look at ways that they can impact the community and make things better for everyone. So one of the ways that we reach out, and we wanted to make sure that everyone on this call knows about, is our program called FACES, which stands for Families Advocating, Connecting, Education, and Supporting. And this is just our basically grassroots local fund support groups, if you will, and they're spread out across the nation. Ryan Fisher is our Senior Vice President of the Community Engagement. I put his number there, so it's something that it's a local resource. So if you have a family and you want them to talk to another family, so it's a great way to get them in touch with somebody who's been through the diagnosis. They have a child with Duchenne, they know the local system, and are also plugged in to our resources as well. Another great resource for you all to know about is that PPMD has what's called Certified Duchenne Care Centers. And this program started about 1.5 years ago. We have a set of guidance documents that were created by collaboration of different providers throughout the nation that are leaders in the Duchenne care area. And then each site that you see listed here has gone through an evaluation process. It takes about 1.5 days, 2 days. In-person time, there's more time before that they have to submit documents, and we have to review those things for that site to become certified. So it's a very rigorous process that these facilities have gone through, but we know that the care that's provided at these centers is in accordance with the care guidelines that have been published. So this is something that we are expanding every day. We currently have 11 care centers, but there are more coming throughout the year. So very exciting development. And so when we discussed earlier that we needed to improve the availability of genetic testing as well as improve understanding of genetic test results, one of the ways that we've done that is through the Decode Duchenne program, and Ann Martin can talk a little bit more about that in just a minute. And then she will also go over Duchenne Connect, which is how PPMD has tried to tackle the problem of data collection and rallying the community to advance the research faster in the community. So I'm going to turn it over to Ann Martin now so that she can tell you about how those things can benefit you and your families.
Okay. All right. Can everybody see my screen? I hope. So thank you, Ann, and thank you, Derek, again, for inviting us to speak today. We're thrilled to have this opportunity to talk with you about all of PPMD's programs. And like Ann said, I'm going to be focusing on our genetic testing program as well as our registry. So I'm sure we all know, everyone on this call knows how important genetic testing is, but the next time you see a patient with Duchenne or Becker muscular dystrophy, or somebody who has a family history of Duchenne or Becker, I would just take a minute to ask yourself these questions. Has my patient had genetic testing, and do they actually have a copy of their report? So not just you know, something scribbled on a piece of paper or something from a clinic note that says that it's a deletion, but do they actually have a copy of the laboratory report that has you know, the lab where it was done, the date, the type of analysis that was done, because that's very important to know. And then, of course, do they know their mutation, and do they really understand what that mutation is? So if you see a patient and you ask yourself these questions and you're answering no or I don't know to some of these questions, then I think we could help through our genetic testing program. So Decode Duchenne is our genetic testing program that provides free testing, interpretation, and counseling to individuals with Duchenne and Becker. And we launched this program back in late 2013, and we've now tested over 300 patients through this program. So the criteria for the program I have listed here. So in order to qualify for the free testing, a patient has to be either symptomatic or have a suspected diagnosis of Duchenne or Becker. They do have to have some type of financial barrier, but I'll be honest, we're fairly lenient with that. This can be a patient who either has no insurance, or maybe they have Medicaid, but Medicaid in some states, I'm sure many of you know, does not cover any genetic testing in some states. But this could also be for individuals who have private insurance, and maybe their insurance only partially covers testing, or maybe the patient would just end up with a really high copay or deductible that would make it a big burden on the family. So any of those would qualify as a financial barrier for our program. The other main criteria for testing is that the patient does have to be a legal resident of the U.S. or Canada, so this is not available for international patients yet. Okay, so who is this available for? It's really meant for anyone, so it could be somebody getting their first time testing, so at the initial diagnosis, somebody who's never had any genetic testing. Regardless of their age, they will qualify. But then we're also doing a lot of repeat testing through this program. So if you have a patient who's older and had testing done, you know, a long time ago when the techniques weren't nearly as good as they are today, they would probably qualify for repeat testing, because if they had testing done that showed a deletion but maybe not all 79 exons were analyzed, it could be that the boundaries of the deletion aren't clearly defined, so they would qualify for repeat testing. Or maybe somebody who had the deletion duplication analysis but then never and it was negative, but then they were never able to get sequencing done. They could qualify for sequencing through our program. And even some people who maybe in the past wouldn't have thought that they would need repeat testing, because of the newer, more robust molecular techniques, they could actually use repeat testing. And this includes people with duplications that can be a little bit trickier to clearly define, and even some patients who have just a single exon deletion could also qualify for repeat testing depending on the type of analysis they had done. And we can certainly help you figure out if your patient would be somebody who would qualify for that repeat testing. So all of the testing done through Decode Duchenne is actually performed at Emory Genetics. So thank you, Emory, and thank you, Derek. We really appreciate your support and your collaboration through this program. I just want to highlight our website. This is just a screenshot from one of our Decode pages within the main Duchenne Connect site, and I have the URL there on the slide for everybody, but there's really a lot of great resources for professionals on the website that you can easily access. The first being the application for the Decode Duchenne program. So this is a really simple one-page application that you can print out from the website and either fax it or mail it back to us. So it's a pretty simple process to apply for your patient to get into the program. We also have ways to reimburse for the blood draw cost. If a patient would just really be strapped financially, even afford the phlebotomy cost, we can cover that. We can provide you with an Emory specimen shipping kit. And through the website, you can see under the genetic counseling session, we have mutation-specific therapies flyer, which is a really nice flyer that you can download, or you can request that we mail you copies. But this is a handy resource in that it has a table showing all the different deletions and which exon skipping therapy a patient may qualify for based on their deletion. And then under the clinical trials section, we also have a lot of great information about clinical trials that are actively recruiting on our website. So I really encourage you, if you have a little time, to just check out the Duchenne Connect site and especially the Decode section of the web page. All right, so I did want to just highlight the impact this program has been having on families. We just recently received this email from a parent, from a mother of a son who was tested. She said, "Thank you so much. We're finally getting the blood work done tomorrow after waiting months and months. So we're definitely happy to be going through your program. As hard as the diagnosis will be, we need it. We know what it is, but then we were just hoping and praying that it could possibly be something else. Thank you for providing such an awesome service for so many families struggling with this. I am forever grateful." So we've actually received a lot of communication like this from families who really do truly appreciate this program, because we're basically just trying to make the testing process as easy as possible, because of course getting a diagnosis of Duchenne is completely devastating for families, and as a lot of you know, getting the testing done can be really frustrating. So we're trying to make this testing process as easy as possible on families and professionals as well. And we hope that we're doing that through the Decode program. I do want to thank our sponsors. We have 3 different industry sponsors who are funding the Decode program. That is Sarepta Therapeutics, PTC Therapeutics, and BioMarin. So I really want to thank all 3 of them, because the program would not be possible without their support. Okay, and I did want to just comment on carrier testing, because I know that's a really big question that a lot of genetic counselors and physicians have. I think many of you listening today have experienced frustration trying to get carrier testing for your patients, especially finding the lowest cost option, because so many insurance companies will not cover carrier testing. So we are happy to help in that situation. Unfortunately, right now, the Decode Duchenne program cannot provide free carrier testing, but we do have access to reduced rates through a couple different labs, and we can help you find the best option for your patients. And even for patients out there that may not have access to a genetic counselor, we can work with them directly to help coordinate the logistics excuse me, of getting the carrier testing done. So I did want to just highlight the fact that earlier this year, it was actually on Mother's Day, PPMD launched a new carrier initiative because they really, over the next year or two, want to focus on the female carriers in our community because they're so often forgotten about. But one of the main objectives of our carrier initiative is to help women obtain carrier testing and really understand the importance of that testing, not only for future pregnancies, but also for other female relatives in the family who are at risk to be carriers, and also very much so for their own health, because as I'm sure many of you know, the female Duchenne carriers, some of them can have some fairly significant cardiac complications from being a carrier, as well as muscle weakness and fatigue. So if you are in a situation and you need help getting carrier testing coordinated for one of your patients, feel free to reach out to us. We are happy to help in any way that we can. Okay, so now I'm going to transition into another important PPMD program, and that's the Duchenne Connect Registry. And for those of you who are not familiar with Duchenne Connect, it's an online self-report or patient report registry and resource for individuals with Duchenne and Becker, as well as carrier females. And Duchenne Connect was established by PPMD back in 2007, so we will be 10 years old next year. And we have over 3,500 registrants at this point. Duchenne Connect is an international registry, so we welcome registrants from all over the world. And this map shows all of the countries that are represented in Duchenne Connect. We actually have over 100 countries in the registry, which is really remarkable. The majority, I'd say about 2/3 of our registrants are living in the United States. So that is really the focus of the registry, are the U.S. registrants. So the goal of Duchenne Connect when it began, and I think even still to this day, is to really connect all of the different stakeholders in the community. So we're trying to educate and connect the entire Duchenne and Becker community. So that includes not only the patients with Duchenne and Becker, but also their families and caregivers, their healthcare providers, and of course the researchers as well. So how do we do that? We do that a few different ways. So one, of course, is through education. I've mentioned on our website we have a lot of great educational resources for families and professionals. We send out a newsletter, so if you register, get on our email list and you'll receive our newsletters as well as email blasts. We're also very active on social media, so anyone who's a big Facebooker can like us on Facebook, and we're also on Twitter as well. And we have a great webinar series that we do with PPMD. Recruitment is another actually very important service that we provide through the registry. So when a sponsor is recruiting for a trial or a research study, they often reach out to Duchenne Connect, and we can perform targeted recruitment through the registry. So we can search the registry to see who appears to match the inclusion criteria, and then we can email those registrants and let them know that, you know, hey, your son appears to match criteria for this trial, and this is who you contact to get more information. So it's really a great service for families because, as you know, there's so much research going on right now in Duchenne, which is really exciting, but it's also really overwhelming, especially for the family. So to know that this service exists through the registry is really appreciated by the family. I've already mentioned our genetic testing program that we're doing, and then of course another one of our main goals is to advance research by sharing the data that we collect. So of course when we share data it's all de-identified, but we do provide data to a lot of different institutions, many of them being industry at this point, but also with academic researchers and clinicians. So if you haven't been to our website, this is just a screenshot of our homepage, and I wanted to point out that we have a couple new videos, whiteboard videos on our website that are really fun for patients and families to watch because they're very short. They're only about a minute to a minute and a half long, and just very fun and engaging, and they do a good job of explaining what the purpose of the registry is and why it's important to join, and how when you join, you're not just giving your data, you're actually getting a lot in return. So we really try to give back to the patients and families who are taking the time to enter in this information. So I encourage you to check out our website and look at the videos. They're on our rotating banner, but then they're also under that section on the top there, the webinars and media section. Our site is entirely mobile friendly now, which is great. So patients can log in and register and update their medical history surveys from any device, their smartphone, tablet, or just a traditional desktop or laptop. So we're really trying to make the registry just more user-friendly for patients and families, and this is one way we're doing that. So if a patient were to register and set up an account, this is a screenshot of what their registry would look like, kind of their dashboard or profile page. And I just am showing this to highlight the different aspects of the registry. So you'll see on the left are all of the medical history surveys. So we have about 12 different surveys now for patients to complete, and we do ask the patients to update these at least once a year. But a lot of these are very short, so I know it looks like a pretty long list, but some of these only take a couple minutes to complete. Others might take more, like 5 to 10 minutes to complete. But we have a module for everything from muscle function to corticosteroid use, heart function, lung function, even a behavior and learning module. So these don't all have to be completed at once. The patients can log in on their own time and complete them, you know, as time allows. Also here from the profile page, they can upload any test results they have. We do ask that all patients upload a copy of their genetic test report because we need that information, obviously, for confirmation of the diagnosis. But a lot of patients have been uploading more results as well. We'd like to get the echo or MRI result and also the spirometry result. But some patients have told us they like being able to upload a lot of their medical records because they like just having a place online where they can safely store all of their medical records. So that's a nice feature for patients. You can also add family members. So this is ideal for families where they have 2 or more affected children, or maybe the mom is a carrier and wants to register herself. They can all be linked together here. Patients can also add their healthcare providers. They can track their height and weight, and they can even invite others to join through the registry. So there's really a lot that can be done within the registry system, and you'll see here along the top there's also all of the tabs that highlight the different informational resources that we have on the registry. Okay, so what happens to all this data once it's in Duchenne Connect? I know a lot of people wonder that, and this diagram is a bit complicated, but just trying to highlight what does happen. So, of course, in this case would be the patient. They would enter in their information via the medical history surveys they complete, some basic demographics they enter, and their genetic test report that's uploaded into the system, or it can be emailed or faxed to us. But that comprises their Duchenne Connect data. So on the right-hand side of the screen, you'll see what we do with it. So our team at Duchenne Connect, the genetic counselors, we review and curate this data, and then we can notify the patients and families when there's research opportunities that appear to benefit them. And I mentioned that before with the recruitment. And we can also provide, specific support based on their needs. Another way the data is used, I mentioned before, is with industry. We have a lot of interest in the registry now from industry because there are so many new therapies in development and so many trials that are starting. So we're frequently asked for feasibility data for trial planning. And then, of course, the data is also shared with researchers, with qualified researchers. We provide data to them, both clinicians and more academic researchers, but then also with our global registry that I'm going to mention in a minute. So one thing that's nice to point out, if you have a patient, because obviously not every patient is going to be interested in participating in a clinical trial or a research study. So just by joining Duchenne Connect and completing the medical history surveys, they're providing valuable data that will help with research and will help in the fight to end Duchenne. They don't ever have to leave their home. So it's an easy way to participate in research and for families to feel like they're doing something more. I did want to mention the partnerships we have with some of our other networks. Duchenne Connect is part of the Treat NMD neuromuscular network, so that's a large international network of neuromuscular registries. So certain key elements that are entered into Duchenne Connect are then shared with the global registry. We're also a member of PCORnet. I'm not sure how many people on the phone are familiar with PCORnet, but it's basically a large network of networks. There's a group of 20 PPRNs, which are the patient-powered research networks, of which Duchenne Connect is one. And then there's 13 CDRNs, which are the larger clinical data research networks, the large hospital systems. But these groups are all joining together to create a national infrastructure for patient-centered clinical research. And if anyone wants to learn more about this, they can check out our website or contact Ann Lucas. She's actually the co-PI on this project. And then data from Duchenne Connect is also being shared with DRISC, and DRISC is the Duchenne Regulatory Science Consortium. And this group is pooling data from many different sources, so from registries, from natural history studies, from clinical trials. They're pooling all of this data to develop a Duchenne disease progression model. So I think it's important to know, important for the families to know and professionals that when they do take the time to enter their data into Duchenne Connect, that it's not just sitting there. It is being used by a lot of different people to really advance research and care and treatments for Duchenne. So please help us spread the word. Obviously, the more registrants we have in Duchenne Connect, the more powerful the registry will be. So we really just encourage you to encourage your patients with Duchenne and Becker to register. And I also want you to know that professionals can register on our site as well. If you go to DuchenneConnect.org and scroll down to the bottom, there's a button that says Professional Portal, and you click on that and you can register to be a part of our professional portal. You'll get our emails and newsletters and other information. And again, you can follow us on Facebook and Twitter, or contact us at the email and phone number here. Okay, so in summary, like Ann Lucas was saying earlier, that a genetic diagnosis for Duchenne is just extremely important in this day and age because of all of the mutation-specific therapies that are in the pipeline. And even if somebody doesn't qualify for a mutation-specific therapy, the genetic diagnosis is still so important because everybody needs that to get into any trial or study. And it's, of course, so important for family planning as well. So everyone needs to get their genetic testing. And also, in terms of Duchenne Connect, we just really encourage families to participate in the registry because it benefits not only them, but the entire Duchenne community. And please remember that through our Decode Duchenne program, we can provide free genetic testing to patients with Duchenne and Becker. It's really hard to get anything free these days, so it's a really great program that we can offer. And also, like Ann Lucas had said earlier in the presentation, PPMD has many, many programs that can benefit your patients and families, and you can learn more about them on the main PPMD website. And you can also always feel free to access the genetic counselors that work with PPMD, because there are 3 of us, which is, I think, impressive for an advocacy organization to have 3 genetic counselors, but we're all here to help and all devoted to the Duchenne and Becker families and to the professional community as well. So thank you once again, everyone, for taking the time to join today and to listen. And if you have any questions, I think we can take some questions now through the chat box that's on your screen. And you always can reach out to us after the fact as well at the phone number and email that's provided here.
Thank you, Ann, and thank you, Ann Lucas. We certainly appreciate that wonderful presentation and the tremendous work you're doing for the Duchenne and Becker communities. As you mentioned, we can open up the presentation to questions at this time. Simply click on the chat box, and on the drop-down, select Send Chat to Organizers and Panelists. We do already have a few questions, which is great. So the first question coming from us, the audience, is testing before which year in general qualifies for repeat testing?
Yeah, that's a good question. You can't really go by year. I mean, we don't really have a year cutoff. It really depends on the type of analysis that was done. So it's more of just having to look at the report, and we're happy to do that. If somebody would want to email us a copy of the report or fax that, we can take a look at it and determine if it would need repeat testing. We also just recently, Lauren Mackey, who wasn't able to join the call today, she's our other genetic counselor who's running the Decode program. She did a really nice blog that was posted on the PPMD website, and I think you can actually find it just by Googling PPMD genetic testing blog, and it should come up. But it was all focused on retesting and who, when retesting is needed and who qualifies, and it goes into the specifics about, based on what mutation, whether or not you might need retesting. So it's really not based on a year.
Great, thank you. And second question, are copies of the reports available to physicians if the patients share access?
So copies of the reports that are housed in the registry?
The question may have been around the when patients can upload their own results to the portal, and perhaps a different physician can access them.
Yeah, that's a good question. have explored, and I think the platform that we use, where the registry is on a patient crossroads platform, it does have the ability for a patient to provide a specific URL, like a specific link to a physician so that they could access certain parts of the registry. We've had mixed opinions about that because it seems like so many providers are just so incredibly busy in clinics that they really wouldn't have time to do that. But certainly a patient could log in to their account and view their report, view any of the records they've uploaded, and they can print them out for their physician. So that is certainly a possibility.
Great, thank you.
And for any of our, just want to add, any of the people who go through the Decode Duchenne program, the referring physician gets a copy of that report sent directly to them. We also receive a copy which can be uploaded into the patient's Duchenne Connect account, but the primary report goes to the referring physician.
Great, thank you. Another comment I believe is asking you to extrapolate a little bit on the counseling services available. Is it in person or on the phone? Who is doing it, and is there a charge?
Okay. Yeah, so it's all done over the phone. We're kind of a virtual organization, done through the phone or email. So if somebody has testing through the Decode program, or even if they don't have testing through the Decode program, we're available to help interpret results and talk with patients over the phone or through email about what those results mean, and there's no charge.
Great. Another question regarding your social media activities. So the question is phrased, I like the idea of Facebook, but what does one do in the context of institution limitations and privacy concerns?
I'm not sure where that question, I think with a patient advocacy group, things are a little different than, say, if we were associated with a hospital system. We never share identifying information, though, with any of our activities that we do, be it social media or through the registry, unless a patient has said, yes, it's totally okay. So you might see a blog from us where we highlight a story of a patient, but that patient has given their consent for that to be done. But as far as when we share data with researchers or pharmaceutical companies, all of that is de-identified data. I don't know if that answers that question or not.
Sure, and if not, feel free to chat another follow-up on that question. Another one here is a clinician referral needed to engage PPMD.
No.
Well, no. For the Decode Duchenne program, for the genetic testing program, we do have to get this one-page application, and a healthcare provider does need to sign that. It can be a physician or a nurse or a genetic counselor, just to sign it to say, yes, this patient needs testing, they appear to have Duchenne or Becker. But to actually call us or just use the genetic counseling services, talk to us on the phone, there's no referral is needed for that.
Okay. Another question here, I believe, is around if you test somebody and it comes back that there's no pathogenic variant detected or no mutation detected for Duchenne, do you offer referrals for patients that may be affected by other neuromuscular disorders?
Yeah, we've actually picked up a fair number of other muscular dystrophy diagnoses, particularly limb-girdle. So, so the first part of the question, I should say, we can do further testing. So we start with the CGH array testing to look for deletions and duplications. If that's negative, then we go to sequencing. And then if the sequencing is negative and the physician wants to go further, we go on to do the Emory neuromuscular gene panel. So, and that's all covered free of charge through the Decode program. So, and with the neuromuscular panel, we have picked up a handful of limb-girdle diagnoses. and then you know, the physician just obviously deals with it from that point on, and we can refer people to different limb-girdle advocacy organizations that we know of, but our primary focus is, of course, Duchenne and Becker.
Great, thank you. And I believe the last question here is probably in relation to the patient portal that we saw where patients can upload reports, and then you also mentioned clinical trials. Are patients able to upload their own genetic data if they have it, and then does that link to the clinical trials?
Patients can, yes, they can upload it from their own computer. I mean, if they have a scanned copy of their genetic report or any other records, they can upload it directly into their account. If people aren't able to do that, they can always email it or fax it to us, and we'll upload it into their account. But in terms of the clinical trials, I think what they might be asking is, say if a sponsor wants to recruit for like an exon skipping trial, then yes, we go through the data in the registry, and we can see based on the mutation information that we have, we can determine who would qualify for like the exon 51 skipping trial or the exon 53 skipping trial. But it is important. I mean, we can only do that if the patient has provided us that information. So it's so important for patients to answer the medical history surveys and keep that information up to date, and to provide us with a copy of the genetic test report.
Great, thank you. I believe that was the last question that we had. Anne, I would again like to thank you for your time, and again, all that hard work you do for PPMD and for the communities that you serve. And with that, I think we will close out the webinar, and thank you all for attending. We appreciate it.
Thank you.
Thank you very much.
This webinar will also be is recorded, and we will post it on our YouTube page that you'll all have access to when we send out a thank you email. So everyone have a great day.
Thank you.
Thank you. You too.
Thanks.